Judice Sports and Rehab. Welcome back. We are going to talk about an external rotation strengthening exercise for the shoulder. So this is to help those try to get back into this externally rotated position like you're throwing. You may have seen other videos on our channel or other channels where you're on your side and you're lifting out to the side, and that's a fantastic exercise to get started with shoulder rehab. But this is kind of a step up. This is a more functional position. You think reaching up, grabbing a seat belt, or reaching into the back of your car. Those are functional movements that require your arm to be away from you rather than just at your side. So this is very important to progress this movement into external rotation of the shoulder. So this is pretty simple. You don't have to do it exactly like this, but I'll kind of walk you through some different options. So in this scenario, we're going to be sitting. Okay, we're sitting with, what I've got is some books propped up. I want the elbow to be rested at about shoulder height. Okay, if it's much lower, it's not going to be as effective. If you've got it propped way up here, it's going to be too stressful most likely. So I like close to shoulder height. Again, it doesn't have to be perfect. I like to stack books because that's what I've got here in the clinic, but you could use, say, like a regular chair and a bar height table, something like that. You can vary how you set it up depending on your house or your situation, but this is what we've got in the clinic. So we're going to get that elbow relaxed and rested at about shoulder height. What we're going to do is square the chest at 90 degrees away from the elbow, and I'm going to rotate my hand backwards as far as I can. I want to rotate that back as far as I can comfortably. If it feels a little bit tender at the very top of the movement, just stop right at that point of discomfort. We don't want to stop too far before it. We don't want to push through it too much, but get to that point where it's a little bit uncomfortable, and that's a good spot to be. Make sure that the discomfort goes away within a minute or two after you stopping. If this feels too easy with no resistance, you can add a little bit of weight. This is a 2-pound weight. Doesn't take much for you to feel this pretty quickly. Okay, and again, these are more higher repetition, low weight exercises. We're trying to remodel the tissue rather than bulk it up, right? So this is more about mechanics, more about coordination than it is about throwing up 15 pounds with this exercise. You can slowly progress, of course, but personally I wouldn't go more than about 4 or 5 pounds with this exercise, okay? I think that covers everything I wanted to talk about with this exercise. Again, higher repetitions in my world is typically 30 up to 50 repetitions, 1 to 2 sets, just to ensure that things are going in the right direction for you. If you have any questions, please comment below, and please like and subscribe.